Hi, my name's James King and I'm one of the specialist small animal surgeons at our Carrara Hospital with Veterinary Specialist Services. So I'm here to discuss when your animal has been referred to Veterinary Specialist Services for the purpose of some sort of abdominal surgery. This might be primarily straight to a specialist small animal surgeon, or most probably more commonly is you come through our internal medicine department and then you'll be speaking to one of the surgeons at some point during your stay. Prior to any abdominal surgery being performed at Veterinary Specialist Services, the aim is to not only stabilise your animal appropriately for anaesthesia, but also the internal medicine department will likely perform other diagnostic tests to make sure we have as much information as possible prior to actually entering your animal's abdomen. This may sometimes be repeating diagnostic tests that have already been done, and that's purely just to make sure that we've got as much information and not really that the plan would not change at all prior to actually entering the surgical suite. Regardless of the purpose of the open abdominal surgery we're performing, the clip is again quite extensive, which does involve right up to above into the rib cage and all the way down towards the pubis and the pelvis. And the term we use is exploratory laparotomy because this truly is an exploratory surgery, regardless of whether we do have a good indication as to what we're in there to perform. And this is so that no matter what needs to happen at the time of surgery, we're very prepared and able to perform that at the time. So the purpose of abdominal surgery is very vast and will very much depend on your animal's underlying condition. But this can involve occasionally removing certain organs. It can also just move opening organs and then closing again. Or sometimes it can be just taking multiple biopsies because that is the most effective way to get our underlying diagnosis as to what's actually going on. Your pet will be very closely monitored under anaesthesia, and varying abdominal conditions can have markedly large systemic effects which really do involve such close monitoring, and this also then continues into the post-operative period in our intensive care unit where they are closely monitored as well, just as heavily as what they were during the anaesthesia. So the length of hospitalisation that you can expect when your animal's undergoing abdominal surgery is again very variable and will really depend on not only the underlying condition but also some of the follow-on effects of that underlying condition. And this can vary from overnight stay to potentially a week or more. And this will be obviously very closely discussed with you for the entire time your animal's in hospital. But it is important to know that this can vary depending on your animal's condition. So after your animal is discharged and heading home, we would always usually prefer them to have been eating before they go home, but some animals this is not always the case depending on their will to want to eat while in a hospital environment. So monitoring their eating habits as well as keeping them calm and refrain from any sort of running and jumping in that initial sort of 2-week period. But any concerns that you see, any declines, we would like to hear from you straight away. We would also like to get you to assess the wound at least twice a day, and what we're looking for is any signs of a discharge or any inflammation that's getting worse after you've been discharged from the hospital. And in all honesty, if you're ever concerned, then we would like to hear from you. If you have any further questions about abdominal surgery with Veterinary Specialist Services, please never hesitate to ask one of our surgeons or internal medicine specialists.